This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. Tonight we continue our COVID conversations. We want to get to the heart of COVID-19's impacts and what they've meant for you. My co-anchor Mark Kiesling got the chance to speak with Dr. Ngozi Ezike yesterday. Dr. Ezike is the director of the Illinois Department of Public Health. I'll turn it over to their interview now.
We're joined tonight with the director of Illinois Department of Public Health, Dr. Ngozi Ezike. And Dr. Ezike, we want to just thank you for taking time to have this COVID conversation with us today. First of all, for those viewers who may not be familiar with you or your role, can you tell us briefly what your role is as the director of IDPH?
Great. So yes, I'm very fortunate to be able to serve as the director of the Illinois Department of Public Health. You know, we have over 200 programs that we run throughout the state to essentially protect the health and safety of all the residents of Illinois. A lot of time, obviously, has been dedicated in the last 18 months to navigating this global pandemic and crafting our pandemic response to the virus.
18 months ago, when this COVID pandemic began, did you have any idea that it would be lasting this long?
I think we might have had a clue about the duration. I think we didn't know it was coming, obviously, but you know, the only experience that we have through the history books with pandemics is the one, you know, the most serious global pandemic was 100 years ago, and unfortunately that lasted over 3 years. So I guess there was a clue. We were hoping we could do things better, you know, 100 years later, but you know, 18 months in, we're still at it.
You are Harvard educated. You're a board certified internist and pediatrician. You've been a medical director at multiple facilities. In your training and your practice, how has this challenge shaped up to anything else you faced in your career?
This is definitely an experience and a challenge of a lifetime. I pray that there won't be anything that will surpass this in terms of the challenge that it has presented. But I feel like all the past experiences have been helpful and have been brought to bear. All the different skills and talents have been, you know, corralled to help lead this amazing group of public health professionals, not just at IDPH, but all the local health department leaders as well.
We were starting to see some progress, it looked like, against COVID-19 in June. Numbers were good throughout the state, and now in August we're seeing this spike in cases because of the Delta variant. So what kind of challenge has the Delta variant brought to you and health departments statewide?
So unfortunately, this virus is doing what we know viruses can do, and that is that it can mutate. And so I think from the very beginning, we were signaling how important it was for everyone to participate in the vaccination effort, because until everyone had that protection, we would really give the virus a continued playground with which to play and mutate. And so that's what it's done. And we have seen successive, you know, iterations of this virus become more and more of a problem. And so this Delta variant has been more of a problem than even its predecessor, which the B.1.1.7 variant. And I'm worried that even if we continue to make progress against this Delta variant, if we're not working quickly, i.e. vaccinating as quickly as possible, there'll be yet another variant that will cause even more headache for everyone, vaccinated and unvaccinated alike.
What do you tell those frontline workers who are growing weary from this long battle?
I want to start off by telling them thank you. Their efforts, they have done a tremendous service for the people of Illinois, whether people recognize it or not. They have fought for so many lives. They have made advances in the care of patients with COVID. They have given of themselves and by proxy their families as well. So a huge thank you. And I want them to know that as their partner on the public health side, that we are working to do all that we can to make their lives easier. So we are continuing to push on the vaccination and the messaging to get people to do the things that they need to do so that we can decrease the number of patients going in.
How is the state working to overcome this vaccine hesitancy, and how frustrating is it for you as a health worker?
Well, obviously we would love to be able to make more progress on this variant. And I think the knowledge that if we can't turn enough hearts and minds to, raise up their sleeve and get vaccinated, we'll be talking about a new variant in a few months. And so there's an urgency to get as many people vaccinated as possible. I think many people are acknowledging that they need to get vaccinated. The numbers of vaccination are going up. And so I am heartened by that. And we will continue working and partnering with different messengers, whether it's healthcare professionals, whether it's athletes, whether it's pastors, anyone who wants to partner with us. Unfortunately, that includes people who learned the hard way in their family how important the vaccine is. We're partnering with all of these people to spread the word out, whether it's through our community ambassadors. We have over 1,000 individuals spread out the state that have partnered with IDPH to put out information on their social media to engage their personal network. So we're really trying to leave no stone unturned, hoping that someone will say the right message to them in the right way that will help them make the right decision for our entire community.
Are there any discussions right now about reverting the state of Illinois back to some stronger mitigations that we saw last year in this COVID battle, if this Delta variant if we don't kind of turn the corner on this variant?
A year ago, a year and a half ago, we were in a much different place. We were still trying to understand this virus, understand how it's diagnosed. We were still trying to get enough testing. It was a different situation. So we had very limited tools in our arsenal with which to push back on this novel coronavirus. That was what we were calling it at the time. We know what it takes now. We know that masking works. We know that this vaccine works. So we need to work on the tools that we have, because nobody benefits when we have to, shutter businesses and another establishment. So if we can all work together using the tools that are safe and effective that work, we won't have to go that other route. But of course, we discuss, everything all the time, hoping that that's not a lever that will need to be pulled again.
Dr. Ezike, it seems that everyone has a family member or a friend that has been personally affected by COVID-19. Are there any personal stories that you can share with us where you've seen this firsthand and how it's affected your friends or family or coworkers?
I have colleagues in the field that have passed. I have relations that have been ill, have passed. This, again, like you said, this virus has not, I don't think anyone has been untouched by this in very significant ways. I've heard many personal stories, both of people who work in state government. I've had people reach out who wanted to share their stories, people who were once strangers but wanted me to know what happened in their family and absolutely wanted to be part of making sure that no one else endured the same fate. So I'm hearing many stories, and it's heartbreaking, because at this point in this pandemic, these deaths are preventable. We have enough vaccine in the state for everyone who's yet to be vaccinated. They're sitting in refrigerators and freezers throughout the state. And so as these 220 people end up in the hospital, admitted to the hospital every single day, all of them can be prevented with a simple action that's free, that's safe, that's effective, that 7 million people have already done in the state. And the failure of more people to do it is why this pandemic lingers on. And just to bring it home, as we fill up people in the hospital with COVID, as we stretch our nurses and doctors working in the hospital, that threatens the quality of health care of everyone in the hospital. When you're at full capacity or beyond capacity, right now in Southern Illinois, there's one remaining ICU bed. And we know how many people will get admitted in the next 24 hours. That means that we are beyond capacity. And so those nurses and doctors, instead of taking care of a certain number of patients, they are stretched. And so whether you're in there for, an orthopedic problem, a heart problem, an appendix problem, or COVID, you're not getting the same care and attention that you would ordinarily get because everybody is so stretched. So why don't we remove the COVID patients out of the equation by getting vaccines that will keep you out of the hospital, and let's take care of the people in the hospital at a normal pace. I think that's a benefit that we all want to see.
Thank you, Dr. Ezike. And we will have this interview and much more COVID-19 information on our website, WSILTV.com.